Hi, I'm Dr. Pedro Ramirez, Editor-in-Chief of the International Journal of Gynecological Cancer. I want to thank you for being a reviewer for this journal. During this presentation, I would like to have an opportunity to discuss with you what are some of the things that we consider are important for a reviewer that is working on our team at the International Journal of Gynecological Cancer. I want to talk about some of the reasons for becoming a reviewer, and we certainly thank you for being a reviewer. How to become a reviewer for the journal. What are some of the expectations from the International Journal of Gynecological Cancer of its reviewers? We want to talk a little bit about the metrics on reviewer performance and some of the items to avoid as a reviewer. In addition, we want to share with you some of the terms from our journal towards the reviewers. Certainly, we consider that it is very important to become a reviewer for the journal. We think that as reviewers, we have a scientific obligation to our community to share our knowledge, to impart questions on the data that is presented for publication. I think it also helps to assure that the published literature is novel and is of very high quality, and that it reflects certainly on the quality of the journal when we have outstanding reviewers. We also consider that this is a great learning opportunity for reviewers in that by reviewing manuscripts, they have a chance to learn what is the latest research that is being conducted within our field. It also reciprocates professional courtesy. In other words, we are expecting other reviewers to do a great job when we submit our papers to other journals as well. So therefore, this is an opportunity for us to give back as professional courtesy. I think it also provides an opportunity for professional growth and promotion for many of us. And we have a global responsibility to highlight the great research that is being conducted in many corners of the world. In addition, as a reviewer for this journal is an opportunity to become a member of the editorial board. As I'll speak a little bit later, the top 3 reviewers from the previous year in our journal will automatically be offered an opportunity to become members of our editorial board. If interested in becoming a reviewer for our journal, we would encourage you to contact our managing editor, Lindsay Struckmeyer, at the email provided here. Once invited, provide the following information: an updated name, institution, and contact information, as well as your choice of preference topics for review. These will be used by the associate editors and the editorial team to assure that only manuscripts within your field of expertise are submitted to you. In addition, we consider that one should invite friends and colleagues within the scientific community of gynecologic oncology to also become reviewers for our journal. What are some of the things that we expect from you as a reviewer? We obviously want to have a very time-efficient processing of our manuscripts, so therefore we ask that you do a timely response as to whether you're going to accept or decline an invitation for review. Once you accept that invitation to review a manuscript, we wish for you to return that review completed within 14 days to provide detailed review that clearly outlines questions or comments, to provide detailed review specific to that particular set of authors, and also to provide statements to the editors regarding your decision, whether your decision is to accept with minor revisions, with major revisions, or to reject. The reviewer should always declare competing conflicts of interest, and certainly we anticipate that one would decline such reviews if you do have a conflict of interest. The decision to accept or reject a manuscript should be based on the relevance of the data to the literature and or the clinical practice, on the originality of the topic that is being addressed, on the methods and the study design, and certainly on the language quality of that particular manuscript. When considering the metrics for reviewer performance, you should keep in mind that we will look at the number of review invitations that are submitted to you, the number of times that you accept to review or decline to review a manuscript, the time from our invitation to your decision to determine whether you're going to proceed with reviewing that manuscript or decline to review that manuscript, the time from accepting to review to submission of that review to the journal. And again, that'll be very important because, as I mentioned, we want to allow approximately 14 to 15 days for that review to be sent to the journal. We're also going to be looking at the quality of comments and questions to the authors. In other words, ideally, we want you to be extensive in the way that you evaluate a manuscript and be critical and have scrutiny of that manuscript. So therefore, provide ample comments and questions to those authors. And certainly, we would also be looking at the overall rate of decisions that you have rendered as accept, major or minor revisions, or reject. When performing a review, we encourage you to consider general rules on the ethical aspects of reviewing a manuscript. We want you to look at whether the authors have published the research before, or whether the authors have plagiarized another publication. We want you to consider, is this research ethical? Has appropriate consent been obtained? And is there any indication that the data has been fabricated, or that the data has been manipulated, or whether the authors have declared all conflicts of interest? These are very important for every manuscript that you review. In considering how you perform that review, we encourage you to express your views clearly with supporting arguments and references as necessary to the authors, as the authors will look for very specific details on your comments. Also provide constructive criticism and an opportunity for the author or the authors to provide a response to your comments. Have realistic expectations when requesting additional data or analysis of any particular manuscript. In other words, do not request data that you know will not be available. Provide specific comments that address gaps or flaws in the study, rather than generalized disagreements with the overall principle of the manuscript. You should pose specific questions pertaining to each component of the manuscript. In other words, the abstract, the introduction, the methods, the results, and the discussion. We encourage also to provide very detailed comments to the authors with information regarding the page and the line number, as this will make it much easier for the author to particularly address that comment. And certainly base your comments on what is considered the standard of care whenever possible, or the general practice in that field, rather than your own institutional or personal practice. When evaluating the title page of the manuscript, assure that the title is consistent with the content and the findings of the study. And also assure that the author designation is appropriate to the field of study. One should always evaluate the abstract to assure that there's a clear study objective provided to the readers, and confirm that the information provided is consistent with the methodology, the results, and conclusions of the study. As a reviewer, you should also assure that all the numbers and the statistical reporting is consistent with those found in the results, and also confirm that the conclusion is consistent with the data presented and analyzed in the results. When evaluating the introduction, it's essential that the background regarding where the field currently stands should be provided by the authors. There should be a clear statement regarding the relevance of the subject presented, and there should be information as to where the gaps in knowledge lie within that field, as well as a clear statement outlining the goals and objectives of that particular study. As we all know, the methodology of any manuscript is essential, and one should be very careful in evaluating the methods of a particular study as a reviewer. There should be a statement confirming that the study was conducted with approval from an institutional review board. There should be information on how the data was collected and detailed, information on the type of patients evaluated in the study, specific details on the tools and strategies of how the study was conducted, and details on the inclusion and exclusion criteria for that particular study. One should be very critical about the adequacy of the methods of the statistical analyses, and there should be documentation of what was the consent process for that particular study. If reporting on a prospective trial, there should be a registry number for that trial documented in the methods section. In evaluating the results, all the data presented in the results should reflect what was proposed in the methods. Details should be provided on the total number of patients included in the final analyses and the total number of exclusions based on the exclusion criteria. Data should be provided chronologically. In other words, the demographics should be presented first, pre-treatment data, treatment, post-treatment, and outcomes. As a reviewer, you should assure that all the numbers and statistical figures match the abstract and the figures and tables. Assure that the results only contain the data reporting and not interpretation of that data. Assure that only data that is relevant to the study objective is presented in the results. And to also assure that the supplementary tables and figures are provided, that data is consistent in those supplementary tables and figures with that reported in the results. When evaluating the discussion, we always encourage our authors to begin with a clear and concise statement summarizing the main finding of the study. It should definitely not be a repetition of the results, and the findings should be compared to those of other studies evaluating very similar questions within the literature when this is applicable. There should be a statement that highlights what is offered by the study that is novel in comparison to the published literature. There should be a statement on how findings are reproducible in other centers, provide information on strengths and weaknesses of the study, and a definitive conclusion as to what should be the change in practice or future directions of the field based on the findings of that particular study. When evaluating the references, we encourage you to assure that the majority of the references are current, to confirm that references are of the original study rather than of a secondary publication, that the references should not be exhaustive on a particular topic. In other words, if the author could have used 1 or 2 or 3 references, then not using a number greater than that. Confirm that references are not repetitive, and confirm that reference numbers from tables or figures match those in the reference list. When making a decision as a reviewer, as an accept, a minor revision, a major revision, or a reject, we encourage you to consider the following items. Accept should be provided as a recommendation when there are no changes required of the authors and the manuscript, and noting that this manuscript will be accepted exactly as it has been submitted. We don't generally recommend that this should be the initial recommendation to the authors. Minor revisions, the authors have met most of the criteria as mentioned above. The required information is easily attainable by the authors, and this requires minimal changes in any or all portions of the manuscript. In other words, minor edits on language and grammar. These are all items that will be considered when suggesting a minor revision. Major revisions should be recommended when there are substantial changes required in the manuscript, but with consideration for publication, provided those changes are addressed by the authors. Major additional information is requested of the author, but within the feasibility for those authors. There should be a requirement for reanalysis of portions or the entirety of the data, or if there is substantial changes to the discussion requiring different interpretations of the data to conform to the analysis and presentation of such data. Significant language or grammatical edits required should certainly be considered for submission to the medical editor of the International Journal of Gynecological Cancer. If rejecting a manuscript, the criteria should be that the manuscript presents a topic that has been previously published in either a larger cohort of patients or a prospective trial with very similar results. When the methodology is inadequate to answer the question proposed, or when the results do not reflect or support the proposed methodology or are incongruent with the primary objective. when there is interpretation of the data that is not supported by the results of the study, and when the data has been previously published. In addition, with the conflict of interest promoting a drug or a product, we certainly do not encourage accepting manuscripts of such kind. When there are major concerns for plagiarism from prior work, or the grammar and language is not considered appropriate even beyond consideration of edits by a medical editor. There are a number of items that we ask our reviewers to avoid, and we ask that you pay particular attention to these items. Please do not make any statements to the authors as to whether their manuscript should be accepted or rejected. These statements should be made only to the editor. These statements are confidential and are only to the editor. Do not request information that is logistically not possible to obtain based on the nature of the study. Do not make any personal criticism of the authors. Also, the transfer of responsibility as a reviewer to someone else, like a medical student, a resident, or a fellow, without providing direct supervision and oversight of the review provided by such individual, is discouraged. Refrain from imparting personal bias onto the review. Under no circumstance should the reviewer make the contents of the manuscript submitted for review public, nor discuss unpublished material. And a reviewer should never accept a manuscript for review when there is a clear conflict of interest, either in favor or against the data or group submitting the manuscript. We want to share some of the terms from the International Journal of Gynecological Cancer to our reviewers. As I mentioned previously, the top 3 reviewers from the previous year will automatically be offered a position in the editorial board for the journal in the subsequent year. The identity of the reviewer will not be revealed to any author. Reviewers will not be asked, unless in very unique circumstances, to re-review a manuscript once authors have addressed their comments. Reviewers will not be asked to secure additional reviewers for a manuscript. And the International Journal of Gynecological Cancer will not make public the personal performance ratings or scores of each of the reviewers. I would like to share some of these resources that you may find very useful when performing your review. I want to thank you again for reviewing for this journal and being part of this team, and for your contribution to the field of gynecologic oncology.